You know that familiar whistling sound you sometimes hear when you breathe, that wheeze. While it can be a common symptom, how do you know when it is more than just a minor irritation and warrants a doctor's call? It is definitely time to call your doctor for wheezing when it is new or suddenly worsening, especially if it is accompanied by shortness of breath, chest tightness, or if your usual treatments do not bring improvement. These are key indicators that something might need immediate attention. These symptoms often signal a significant reduction in the airflow to your lungs, which is a critical concern, particularly if you have chronic obstructive pulmonary disease. Reduced airflow can lead to your body not getting enough oxygen, potentially indicating a flare-up or another underlying issue that requires prompt medical evaluation. Pay very close attention if your wheezing becomes more frequent, louder than usual, or if it starts to interfere with your daily activities. Look out for any difficulty speaking, dizziness, or confusion, as these can be serious signs of severe oxygen deprivation. If your prescribed rescue inhaler does not bring relief within 15 minutes, or if you find yourself needing to use it more often than your doctor has recommended, that is a clear signal to seek medical advice. Additionally, any fever, chills, or the production of discolored mucus alongside your wheezing should prompt a call, as these might indicate an infection that needs treatment. An insider tip for managing chronic obstructive pulmonary disease is to keep a simple symptom journal, even just mental notes. Jot down when your wheezing starts, what seems to make it worse, and what actions or medications provide relief. This detailed information about your personal triggers and responses can be incredibly valuable, helping your doctor to tailor your care plan more effectively and adjust treatments as needed. Being proactive and understanding these specific warning signs empowers you to act quickly, ensuring you receive timely medical support. This approach helps you maintain better control over your lung health, potentially preventing a minor issue from becoming a more serious complication.